Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Tricia Paige. She's Senior Director with the J-Screen program at Emory University in Atlanta, Georgia. She received her Bachelor of Science in Genetics from the University of Georgia and received a master's degree in genetic counseling from the University of Texas Health Science Center in Houston, Texas. She's here today to speak with us about some of the changes that she sees in genetic testing. The industry is only a few years old. Well, not a few years. I think since the late 60s, genetic testing has come on the scene in a more mainstream way. But today there have been so many advances, and she's here to talk about some of those advances and some of the advances that she sees on the horizon. How are you doing today, Tricia?
I'm great. Thanks so much.
Senior Director with the J-Screen program. You're a genetic counselor there at Emory University. You've been involved with genetic counseling for how long now?
Gosh, probably longer than I want to admit. I guess maybe 10 to 15 years. 10 to 15. I've had to count.
So that's long enough to see some sweeping changes in any industry. 10 to 15 years from the beginning of an industry up until the time that you entered it just 10, 15 years ago. When it comes to DNA testing, genetic testing, we talk about genetic testing to test for predisposition to cancer, or maybe some type of a birth defect, or maybe even a disease other than cancer. What are some of the changes that you've seen since you've been in, and some of the changes that you were told about from some of the folks that mentored you? And then we'll get into some of the things on the horizon in the future that you foresee, okay?
Yeah, things have absolutely changed. It's I think one of the most fast-moving fields, which I love. There is constantly something to learn as a genetic counselor. So if you're the kind of person who likes to learn, then this is a field for you for sure.
Always changing.
Yeah, constantly changing. It keeps you on your toes. So when I, finished graduate school, there was genetic testing for around 100 diseases. Okay. Now there are tests available for more than 3,000 diseases, and our ability to just to really try to find answers for people is so much greater today than it was in the past.
You're talking about finding answers for people. Obviously, having been in the industry for 10 to 15 years yourself, what types of advances in the understanding and the interpretation of, say, certain test results? You say there were 100 diseases that were available to be DNA tested. Now there are over 3,000. As far as understanding and interpreting these results, are we getting any closer to absolutely wiping out any diseases on a genetic level?
No, I wouldn't say that we're close to wiping them out, or most of where the field is today, honestly, is still in the trying to provide answers phase. I will say that one of the, another great change that I've seen is that we really now are able to start treating things. There are new medications, for example, for conditions like cystic fibrosis, that now that they're medications that are specifically targeted to people with specific genetic changes. And if someone has that particular mutation or genetic kind of variant, then this medication is very effective for them. So treatments, and that was really unheard of, when I was in school. And so it's really, kind of amazing to see that. But back to sort of our ability to understand, because that's kind of the first step. If you're going to treat someone, first you have to understand what's going on with them. And when I started my career, we were told, there wasn't really any kind of genetic cause for autism. For example, we now know that in as high as 20% of cases, there is a known genetic cause. And we have testing now that we can do, for people who who are autistic, to try to figure out what it is. that is causing that. And the next step will be, being able to treat that. And we're not there yet, but we're certainly making, great strides in that direction. And I don't think you can overvalue the people. Just we all want to know why something happened when possible, and sometimes people blame themselves if they have a child that has some kind of difficulty, and so being able to provide an explanation. That's true for autism, but that's true for so many parents that are just struggling to figure out, even if there's not anything today that you can do, having a name for what's going on, and then being able to connect with other parents who have children with similar conditions, and then connecting with researchers who are working on that. Yeah, it means the world, really. So, it's really great that we're now able to do that. There's certainly a lot of work. Yeah, go ahead.
Well, you mentioned the few number of diseases that you could test as opposed to the, over 3,000 that you can test now. Say JScreen is working on a cancer project. Is JScreen involved in one project, the entire lab and team? Or can you work on multiple projects, say, cystic fibrosis, cancer, and Down syndrome at the same time?
Yeah, so that's one, another, I'm glad that you asked that. That's another, big change that has happened. So there's something now called multiplex testing, and JScreen actually really uses this. So, we used to be able to, test for one gene at a time, and it was, thousands of dollars to do that one gene at a time, or at least hundreds of dollars. We now, though, are able to do, again, multiplex testing. And what that means is that we can test for hundreds of conditions at the same exact time. And, for the cost of what it would have been to do, one test in the past. And so the tools that we have are just so much more powerful for, for being able to. The screen that the test that JScreen is currently using tests for 104 different conditions at one time on one saliva sample, and so that's much more powerful, and we can give people much more information because of that.
So it seems that the field of genetic counseling has benefited from the healthcare changes here in the United States as far as the cost. And when we're talking about the cost, are there certain portions of DNA testing that insurance will or will not cover, especially now in view of the Affordable Health Care Act?
Right, yes. So, the Affordable Care Act specifically talks about BRCA 1 and 2 genetic counseling, and, says that has to be covered by all insurance plans that are, making the standards. That they have to cover genetic counseling for people so that they can learn about, what their risks are. Now, it doesn't extend always to the cost of testing, but for most insurance carriers, if you have genetic counseling and you meet specific criteria, and like as an example, like if you are somewhat like a woman who has a personal history of breast cancer, or your mother had breast cancer, then you likely will be able to meet guidelines, especially if that those happened at a younger age, and so then once you're into genetic counseling, the testing can be easily organized, and your insurance will probably cover most of it. And they do that because it is really practical information that you can use to reduce your risk of cancer, either the first time or, getting it down the road. So, it's great that it's starting to be really recognized as, as really important. And insurance companies are increasingly covering it, which is great.
Now, as we wrap up, could you talk a little bit about the JScreen program, specifically at Emory University, what you're involved in now, and as far as being able to test multiple conditions at once. Do you see anything on the horizon, maybe doubling the amount?
Yeah, I think that over time we are absolutely. So again, now it's a little bit less than $1 a condition to have screening through us, and we screen around 100 conditions. So I think shortly since we started in 2013, we've increased the number of conditions several times, and I think that trend is only going to increase. The cost of testing for genetic testing is going down, and the number of diseases, the accuracy is going up. So there's nothing really to do but just be very hopeful about the fact that this is going to be something that is going to be useful and hopefully easy to access for for everyone who needs it in the future.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Tricia Paige, today Senior Director with the J-Screen program at Emory University in Atlanta, Georgia. And we've been here talking about some of the changes that she's seen since she has been in the field of genetic counseling, some of the changes that she sees on the horizon, and the benefits of genetic counseling and screening overall. She is Senior Director with the J-Screen program, as I said, but she has worked as Director of Genetic Counseling Services, Program Manager for Newborn Screening, and the Assistant Director of Genomics and Public Health Program. In her current position, she focuses on improving the delivery of genetic services from both an individual and public health perspective, especially in the realm of preconception carrier screening. She's a fourth-generation Georgian, enjoying spending time with her family, gardening, and training for triathlons. It's been great having you here with us today.
Thank you so much. I really appreciate the opportunity.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.